Hello people, welcome to Healthy Living Global. Please note, this is for educational purpose. This procedure may vary in different hospitals, but to avoid abscess, follow this procedure. After following this procedure, that is every 100% sure that, or 99.9% that you are going to avoid injection abscess. Alright, let us go. What we are talking about is how to give IM injection to avoid something like this. Alright, let's go. Now, the reason why I have to come and give this lesson, this is a global platform where we need to do the needful thing or learn how to do the needful thing to avoid some common issues. Alright, we can avoid one we're supposed to avoid. This case was brought to me and I have to talk about this. Let us not forget that the money they use in treating abscess is higher than times 4 of the money of which you may have spent in getting a good professional for this, or even what you have spent in treating your normal sickness or what you were having before going for this injection. Now, what is the goal of someone that is giving injection, administering injection? The goal is what? To make sure that you give the recommended dose and also give it as prescribed. There are some injections that are supposed to be given very slowly, right? That can take 5 minutes. There are some that is only 1 minute. Read the leaflet or follow the procedure. And also another goal of it is for you to make sure you did not give the patient injection abscess, and also you did not introduce infection to the injection site. Another goal also that is very funny is that you will try as much as possible not to transmit an infection or a disease from the patient to yourself, because if you are not careful, you putting back the needle in the cap and it pierces your hand, you know what it can result to. You know that many people have contracted HIV and other diseases through this. Be careful. All right, let's go now. Now, prepare your injection as recommended by the manufacturer. Okay, note that syringe have different parts. All right, there is now this is the needle, this is the needle inside, and this is the cap of the needle. This one I holding the medication itself is called barrel. All right, this is the plunger. This is the plunger. Now, if you prepare your injection, you can allow the patient to lie or stand. Right, you use your own head and draw an imaginary line. I'm going to show you in the little drawing. All right, guys, this is the practical example of what we are discussing. Let's assume this is buttocks. All right, don't laugh. If you laugh, it's at your own risk. Now you draw a vertical and horizontal line in each of the buttocks, all right, or any one of which you want to give. Okay, imaginary line. You don't need to go and bring marker to go and be marking. All right, so the goal of this is to make sure no blood vessel is injured. All right, now all these places of which I marked, there is blood vessels in all these areas. So the instruction says right outer quadrant, that is here. All right, you need to position your hand in a slanted position 90 degrees. All right, you need to inject in all these areas. All these areas are safe. All right, they are very safe. And this one also, so this area is good and this area is good. This is where you are going to give. All right, having known the practical example of the position we are looking for, now we go to the procedures. Right, now you clean that area with alcohol swab. All right, so swab means cotton wool with some like methylated spirit. All right, you need to clean the surface. What does that mean? It's part of aseptic techniques to remove every bacteria or any infection in that area. All right, when you clean it, allow it to dry on its own. Don't blow it. Don't leave it. Let it dry on its own. When it dries, you now insert your needle and aspirate. Remember, aspiration means you drawing back the plunger, all right, to make sure that it did not enter any blood vessel. All right, you draw it back, you check. If blood enters, remove it and discard and prepare a new one. Means you put it in the wrong position. If no blood enters, you are in the right position, especially if you use this particular position of which I gave you in this video. Now, you now begin to inject gradually depending on the recommendation of the manufacturer, all right, or as prescribed by the medical doctor. All right, this particular procedure is not all about you being too professional. This is techniques. All right, please, before you give injection, make sure you are a professional or you are trained to give injection. Please, we don't need injection abscess anymore. So after giving the injection as recommended, gradually withdraw it and apply a cotton wool. All right, just a little pressure of cotton wool on it, all right, to hold it for some times. Then you discard your syringe and needle. all right, in a disposable. Please be very careful, because at that point, you withdrawing, all right, the needle and syringe at that time, if it injures you, sorry for you as a health worker. Please be very careful. If you have not been following our page or you have not subscribed to our YouTube channel, please do so. There's a lot you are going to learn. Health workers, learn this, and we see that we never record injection abscess.